With the sort of near-mystical media savvy on which Donald Trump built his celebrity brand as a novice politician and reality television star, his White House aides specifically asked for World News Tonight anchor David Muir, and not chief anchor George Stephanopoulos, according to knowledgeable people, to conduct Trump's first broadcast television interview of the COVID-19 pandemic.
It was this week, and Good Morning America host Stephanopoulos, a seasoned Democratic political operative turned astute political journalist, who, in a series of interviews with the president over 2 days last June, produced a headline making primetime special notable for Trump's self-immolating bombshell that he'd welcome dirt on a political rival from a foreign government.
This time, while Trump was willing to venture from the safety of Fox News toward the potential hazards but bigger audience of ABC, a calculated risk as he faces an increasingly difficult re-election race in which his approval ratings have plummeted for his mishandling of a pandemic that has killed more than 72,000 Americans, Stephanopoulos was apparently a risk too far.
Thus, by most accounts, including Trump's, the White House got exactly what it wanted from Tuesday's network exclusive, which the Disney-owned network hyped in an afternoon special report, on its 24-hour online outlet ABC News Live, on Nightline, and on Good Morning America, not to mention Muir's flagship weeknight news program, which, with an average of 10.5 million viewers, happens to be the highest-rated show in all of television, catnip for a ratings-obsessed president.
What the Trump White House got from Muir's interview was the strangely calming image of a somber, restrained, message-disciplined president, hardly the whopper-spewing, insult-sniping bully of Trump's coronavirus briefings and Twitter feed, fielding gently posed questions from the imperially slim anchorman who wore an expression of perpetual concern and empathy on his finely chiseled face.
Among ABC News journalists, however, it was a different story.
As the interview broadcasted from Phoenix, Arizona, where Trump was touring a Honeywell factory that had been retooled to make N95 face masks, some of them watched with growing dismay as Muir let Trump utter well-worn talking points and market-test new falsehoods unchallenged, such as the president's complaint that Barack Obama had left behind broken tests for a virus that didn't even exist when Obama left office 3 years ago, while failing to ask pertinent questions.
For instance, Muir didn't grill Trump on his apparent failure to invoke the Emergency Defense Production Act to force private companies to mass-produce much-needed coronavirus tests and personal protection equipment for frontline healthcare workers. He didn't ask him about Vice President Mike Pence's public prediction that the White House Coronavirus Task Force is soon to be disbanded, a revelation that Trump ultimately contradicted elsewhere. He didn't ask Trump's response to Dr. Larry Bright's whistleblower complaint that the National Institutes of Health removed him from directing the government's vaccine research because he questioned the president's bizarre treatment recommendations. Muir didn't press him on the seeming lack of a comprehensive national testing strategy to identify and isolate carriers of the virus, a program that Dr. Anthony Fauci, among other experts, says is necessary. He didn't ask Trump his reaction to red state governors who are relaxing or simply rescinding safety measures in opposition to Trump's own White House guidelines.
It was, in the view of some of Muir's colleagues, a squandered opportunity, a presidential interview that barely made news.
This is literally a matter of life and death, and there was no news, a television journalist from a rival outlet told the Daily Beast. I don't know how you get an interview with the president and not make news.
CNN media reporter Oliver Darcy was especially critical, writing that Muir didn't challenge Trump in any meaningful way. And worst of all, Muir allowed the president to float brazen misinformation with no pushback to his 10 million-plus viewers.
Yet several media critics, notably Poynter's Tom Jones, credited Muir for his tough but fair and not contentious, professional demeanor, and praised Muir for his ability to plow through many topics and call out many of Trump's past missteps.
While ABC News officially declined to comment, a high-level news division source defended Muir's Trump interview to the Daily Beast. David's interview speaks for itself. He repeatedly pressed the president in several tense exchanges, which comes with the territory when you conduct a presidential interview.
Television news analyst Andrew Tyndall, however, was among those who didn't feel a whole lot of tension.
Muir's interviewing style, he said, is, I'm going to sit in a room with you and be your interlocutor, and you can get all your talking points off your chest. I'm not going to be there in order to grill you. Nobody would call it forensic.
One of the studies that the Trump administration is relying on as it moves ahead with plans to reopen the U.S. economy warns that even if states take the necessary steps to ease social distancing restrictions, counties across the country, both big and small, will see a significant spread of coronavirus.
The study, which was put together by Policy Lab at Children's Hospital of Philadelphia, is in the hands of top coronavirus task force officials and people working with the team, sources confirmed to the Daily Beast. It projects that if officials move too quickly and too aggressively to reopen in mid-May, individual counties could witness hundreds, if not 1,000 plus, more coronavirus cases reported each day by August 1. Just 2 weeks more social distancing, the study projects, could reduce infections substantially, with potentially hundreds of thousands of fewer cases if the projections are conservatively expanded out to all 3,000-plus counties across the country.
The modeling shows that those counties exist in various parts of the country, in both urban and rural communities. In almost all cases, counties would see notably fewer cases per day if they waited to ease social distancing restrictions until June 1, according to the study's projections. The model also suggests that states moving to ease restrictions should consider allowing individual counties to craft their own policies. Under the projections, one county could experience significantly different daily case numbers than others in the state, even those nearby, merely by continuing to adhere to social distancing protocols.
There's going to be transmission if people stop sheltering in place, Rubin, the director of Policy Lab at Children's Hospital of Philadelphia, said in an interview. It's not that all counties are safe to reopen. Every area is extremely sensitive to the amount of distancing you're doing. The more cautious you are, the better.
Two administration officials who have seen the Policy Lab study say it is one of the few being seriously considered by the Trump Coronavirus Task Force and that the White House is using it to inform how they advise governors on easing social distancing restrictions. One other official said it is one of a number of studies and data that the administration is looking at in the process of safely reopening the country.
The study's findings raise questions about the White House's push to shift the focus of its coronavirus response away from combating and mitigating the disease and more towards managing it. In recent days, President Donald Trump has talked about reorienting his coronavirus task force towards reopening the economy and insisted that the shift in focus could happen without putting additional lives at risk.
The data put together by Policy Lab suggests it's not quite so risk-free. The authors laid out a variety of projections, including what would happen if there was roughly 33% less social distancing than prior to the pandemic. Such a percentage decrease, they calculated, would represent people in the county going roughly halfway back to normal travel, pre-epidemic, to non-essential businesses like bars and gyms.
Under their projections, if starting on May 15 residents in Los Angeles County were to conduct 33% less social distancing, the coronavirus daily case count would jump from about 471 cases to 1,467 by August 1. Similarly, Illinois' Cook County, where Chicago is located, would see daily coronavirus case numbers spike from 626 to 2,494 between May 15 and August 1.
Among officials working with the president's coronavirus task force, projections like these have sparked fears that states will ignore warnings and move too quickly to completely reopen their economies, prompting coronavirus case numbers and related deaths to continue to rise. That's already happening in states such as Kansas and Nebraska, according to publicly available data from the state's health departments.
A similar study reported by The Washington Post and The New York Times this week shows the coronavirus daily case count surging as high as 200,000 by June 1. The report includes stamps from the Center for Disease Control, Department of Health and Human Services, and the Department of Homeland Security. But officials inside the administration have said the study was not vetted before release.
Unlike that study, Rubin's study looks at the disease's impact locally. His modeling case counts for individual counties as a way to show how smaller communities might begin to think about reopening.
I think what people are taking from the study is that it is okay to have selective strategies for reopening, Rubin said, adding that the study is still in progress and currently under peer review.
The study looks at the coronavirus epidemic across 260 counties throughout the country. The team used publicly available data to model how social distancing, population density, and daily temperatures affect the number and spread of coronavirus infections over time across a county. It accounts for population characteristics, such as age, health insurance status, and smoking prevalence, and uses cell phone movement data to include factors related to social distancing.
The model illustrates 4 scenarios in which social distancing practice reduces from its current national average of 70%, back to either 50% or 33%. It also considers 2 options for reopening, May 15 or June 1.
If Cook County were to conduct 33% less social distancing, or, put another way again, bring its economy roughly halfway back to normal, starting on June 1, as opposed to May 15, it would see its daily case numbers go up to 701 by August 1 instead of 1,868. Los Angeles County would experience a similar phenomenon with its daily case numbers increasing up to 383 by August 1 if it were to bring its economy roughly halfway back to normal starting on June 1, instead of 1,467 if it did so from May 15.
The model identifies social distancing as the most important factor in reducing transmission, but does not take into account what happens when people start ramping up commuting or flying, Rubin said.
The outcomes and the forecasts transfer responsibility back to the individual and the businesses, he said.
3 senior Trump administration officials acknowledged that the White House and the Coronavirus Task Force have been working with doctors at Children's Hospital in Philadelphia in drafting guidelines for reopening the country. One official said the task force is particularly interested in the study's findings that rising temperatures appear to be reducing the risk for large second peaks of coronavirus cases during the summer in many locations. But Rubin says that will only be the case as long as states move forward with reopening cautiously.
No place, including those more rural areas, is immune from the effects of this virus, Rubin said. Temperature alone is not going to solve the problem.
With reporting by Asan Subsang.